Good afternoon, everyone, and welcome to another lecture at AGI. We are pleased to celebrate Creative Art Therapy Month. And what better way to do that is to have our own creative arts therapist join us to talk about a little bit about what they do. For those of you who are not familiar with AGI, we're a charitable organization that provides support and services to people living with dementia and their families. We also try to educate the public, the community, and professionals at large in best practices in dementia care. Today's lecture is made possible by the Lindsay Memorial Foundation and the Lazar Learning Center, and we'd like to thank them for their generous donation. If you have any questions at the end of the lecture, there is a chat and a Q&A function that you can just write in your questions. In the meantime, you will be on mute, but I will be sure to make sure that your questions are answered as long as we have enough time. So without further ado, I'd like to introduce you to my colleagues. We have Kayley Patterson. Kayley Patterson is our newest member to AGI. She finished her master's program in creative arts therapy in September of 2021. She has experience working in a hospital setting, a community center setting, as well as respite setting. So we are pleased to have her join us as our music therapist. And she also participates, she also facilitates, our Monday and Wednesday sundanning program. We also have Karin Derouaux. Karin Derouaux is an art therapist and counselor at AGI. She has been with AGI since 2008, and she strongly believes in best practices with people living with dementia, and will talk a little bit more about what she does. So please, the floor is yours, ladies.
All right. So I'm going to start by sharing our screen so you can see our presentation. Just bear with me for a second here. All right. So to start off, I was actually just in our activity center about 10 minutes ago running an art therapy program. And our participants, I had to leave the room a few minutes early, so I explained to the participants why I was going, and I asked them if they had any advice about what I should say about the work that we do at AGI in creative arts therapies and art and in music. And one of our lovely, lovely ladies who always has really wise things to say said, "You should tell them that everybody has something to bring, and it takes the right person to bring it out." So that kind of sums up the entire presentation in one thing. I was like, well, it took me an hour of slides to get that out, and she wrapped it up in a bow, and that was it. And I think that's a really great summary of what we really try and do at AGI in art therapy and music therapy and recreation therapy and everything that we do. All of our clients have something to bring, and it's our job to help them bring it out and let them shine. So I thought that's a kind of a nice way to start. So today we're going to talk about the creative arts therapies at AGI. And let me just get myself in presenter view so I can see the notes and see who's supposed to say what. All right. If anybody has anything to mention, any comments that you want to make throughout the program, no, we can't see you, which is a little bit frustrating for you and for us. So please don't be shy to use the comments and in the chat. You know, just write if you have a question, if you have a comment, if you have something that you'd like to share, just use the chat, and we'll be able to see it and comment on what you have to say. Okay. All right. So change for the first slide here. All right, so I have a little list here of the services that we have at AGI. I'm not going to go over all of them. We do lots of different things. Those of you who are new to AGI, I encourage you to check out our website. It's being updated, so soon we're going to have a new website, and I'll have everything in the most up-to-date way. You can also give us a call and find out about the services that we offer. If you're a family caregiver, it's a great idea to or a person living with dementia, give us a call, ask to speak with a counselor, and we can help you figure out what services that we have are most appropriate for you. All right, so I'm going to start with what are the creative arts therapies. So the creative arts therapies involve 4 different what we call modalities. There's art therapy. I'm the art therapist at AGI. There's music therapy. Kayley is our music therapist. There's dance movement therapy, which we don't have a full-time person on staff, but we do offer periodic sessions in movement therapy, dance movement therapy. And there's also drama therapy. So those are what we call the 4 modalities of the creative arts therapies. And we really study in a very similar way. In fact, and in the program of Concordia, it's 1 degree. It's called the Master's in Creative Arts Therapies degree, or some of the modalities have a certificate that you can continue into a master's degree. We study all together with some courses in our own modalities. So we often think of ourselves as siblings in the world of therapy. And creative arts therapies is really exactly what it sounds like. We take our art, whether that's music, visual arts, drama, or dance movement, and we combine it with knowledge and clinical skills in the world of therapy and psychology. We put those things together to help people understand themselves better or cope better or generate a sense of well-being. So just like in regular talk therapy, there's lots of different ways of doing the therapy. Same thing with the creative arts therapies. So, you know, you can have somebody who does a lot of analysis of, for example, in visual art therapy, lots of analysis of the artwork, or lots of talking about the art making process. At AGI, we work on a little bit of a different way. My approach as an art therapist, and every therapist's approach is different based on who they work with, what their training is, what their experience is. My preferred way of work and how I work at AGI is an approach called art as therapy. So we don't do a lot of talking about the art. As artist therapy, art therapists believe that doing the art itself is where the benefit is. So this model of art therapy means that we don't talk a lot, we do a lot. We don't look into the symbolism of the art. We help the person understand themselves or meet their own emotional needs and psychosocial needs through doing the art, okay? One of the reasons why the art of therapy as therapy way of doing art makes sense with the people that we're working with who have dementia is because other kinds of art therapy that involve more talk therapy involve having good verbal skills, having lots of insight into yourself, being able to generate that insight, having short-term memory so you can remember from one session to the next what happened. You know, these are things that are affected by having dementia, and so we don't really do that kind of art therapy here. We do, what we do is we observe our clients closely. We get a sense of the needs that they have based on the behaviors that we have, and we create art workshops that strive to help the person meet those needs in doing the art, okay? So for example, if I have a client who has a high need for feeling in control, because maybe they feel like they're out of control in their life, I might introduce an art therapy activity that involves lots of structure and give them materials like markers as opposed to paints, because that will help the person feel more in control and help them meet that need for feeling in control. That's a simple example of the kind of ways that we use art as the therapy, okay? So people don't have to have the ability to talk, have the ability to generate their own insight about what their needs and what their path is, and they don't have to have a good short-term memory in order to benefit from the art therapy. One little thing that I want to mention in terms of what the creative arts therapies are, it's possible to hire creative arts therapists in private practice, and if that's something that you're interested in doing, that's great. Know, however, that creative arts therapist is not a protected title in Quebec. So both in institutions and in private practice, you'll find a lot of people who call themselves music therapists or art therapists or other kinds of creative arts therapists who don't actually have credentials in the field. So when you're hiring somebody to be a creative arts therapist, you should ask whether they have a master's degree or a certificate degree, a graduate certificate or master's degree in that particular field. Otherwise, they may be somebody who has a great way with people and who has a lot of knowledge about their art, but they're not really doing art therapy. Okay. All right.
All right, so this is my slide. So just we wanted to kind of clarify what we are as therapists versus what it looks like to be in a music class or an art class. And there are a number of distinct differences between the two. So first, you'll see the teacher-student relationship. Um, this relationship tends to be inherently hierarchical. So, meaning the teacher acts as a keeper of knowledge and sets kind of specific standards for lessons based on curriculum requirements. As therapists at AGI, we work collaboratively with participants, so we consider ourselves partners. And we see the therapeutic relationship as a critical component of successful therapy. And that relationship does take time to build. We are very lucky that the recreational therapists have set up a very welcoming, inviting space for us too, so that when we enter, they feel that sense of security beforehand. So the relationship that we build is founded on trust, empathy, respect, unconditional positive regard, acceptance of the person and their creative expressions, and collaboration. And we see ourselves as partners in the creative process because we work collaboratively with participants working towards therapeutic goals. It is really ultimately the participants in the moment needs that steer the direction of therapy. So if we're observing a particular behavior, we're responding to that in the moment. Although we do plan sessions beforehand as well, sometimes those get veered into another direction. And we do believe that participants know themselves. They know what their health and well-being needs are better than we do. And so it is really our job to support and meet those needs alongside them while engaging spontaneously in creative arts. Second, the work we engage in with participants is private and remains confidential. So, as music therapists and art therapists, we're bound by a code of ethics that guide our practice. So, for us, what happens in therapy stays in therapy. Whatever is shared by participants, that stays safe and private. And information about our sessions can only be shared after we've gained consent from participants if we think that that is of value at some point. Third, this is very important. So rather than emphasizing technique and mastery, in creative arts therapies, there's really no right or wrong way to participate. And I think Karin and I say that multiple times in sessions, that really what matters most is that participants are engaged in ways that benefit them. And that engagement might look active, like active participation where they're singing or creating art, but it might also mean that they're just taking on a more receptive role and observing what's going on and maybe just listening to the music or looking at the art and benefiting from that. So we don't intend to instruct or educate participants, although we might share a particular tool or technique if we think that that will be helpful, such as learning a song or an artistic style, but that's only to aid self-expression and to enhance emotional well-being. Which leads us to the next point. In the Western world that we live in, there really tends to be a focus on artistic outcome or product. Many of us have learned that music and art are reserved for an innately talented few who've had lessons in music or art, and if anything that's worthwhile is built on that kind of education. But in therapy, we really see every person as possessing a unique sense of creativity. And we're most concerned with participants finding their unique voice or artistic style, no matter what the outcome or the product is. So we observe what feelings or thoughts for participants are coming up in sessions as we engage in creative acts. And our focus with participants is on helping to support whatever is coming up for them. So these processes are more about engagement, expression, communication, tapping into a sense of identity rather than artistic merit. And then finally, both within the therapeutic relationship and the artistic relationship, we're not looking to judge or evaluate participants' artwork. And I'm sure you see this, Karen, I see this too, where people come in and maybe they've had a traumatic experience making art or music. They were told they can't sing maybe, and so they're coming in with that feeling that, oh, I can't do this. So our job really is to encourage participation and really practicing non-judgment. We're simply looking to witness what's true for them. And as I mentioned, creative acts are seen as an extension of the participant, a non-verbal or verbal means of communication and expression. So we welcome and respect whatever it is that participants have to offer of themselves creatively. And since their creativity is viewed as a part of them and who they are now in the moment.
All right, so, we're very lucky at AGI that we get to work in the activity center environment where our recreation therapists are just fantastic at creating a safe place where people can be themselves and be imperfect and try new things without judging each other and without judging themselves. And of course, it's always a work in progress because as human beings, we have a strong judge inside of us. But we try really hard to make the activity center a really safe place for exploration. So one of the things that we get asked a lot is, what's the difference between the person that I care about who's living with dementia doing activities at home versus coming into the activity center and doing them here? And one of the real major differences is that, creative arts therapists and the recreation therapists that we have at AGI, we have an expertise in creating this safe space, this place where people can try new things, in a way that's different, in a way that's fun, in a way that they know it's not going to be judged. There's something about the group environment that allows people, when it's the right group environment, of course, that allows people to feel safe enough to try something that they might not try at home because it would be really anxiety provoking. It's hard in an environment that you've done the same thing all of the time to suddenly do things differently, right? So the space that we create at AGI in the activity center is the space, whether that's online or in the actual physical center, is a space that allows people to feel confident to do new things and to be creative. Other ways that it's different, doing art therapy with an art therapist or music therapy with a music therapist versus doing it at home, is because we do have an expertise in helping clients meet their psychosocial and emotional needs, right? So, if you're a family caregiver and you're looking at your loved one, you may have a realization that that person has a need, an emotional need in some area to maybe decrease agitation or to feel more in control of their lives or to feel like they can be successful. But what might be missing is the ability to figure out, well, what activities, what tasks can I introduce into this person's world that's going to help them meet that need, right? Because talking about it is not necessarily what's going to do the job for the person living with dementia. We have to help people meet their needs through the activities that we do. And that's something that we do here at AGI. We also are able to provide technical support or aesthetic support as needed. Now, our goal as creative arts therapists is never to have the person create a good product. So to sing a good song or to perform in some way, or to create a good, quote unquote, good painting, although it's really hard to decide what makes something good or not good. But, that's never our goal. But what we do sometimes is we will teach or support a person by helping them with a technique in order for them to be able to better use the tool of the art to meet their needs. So if somebody is getting frustrated with a material, we may be able to supply a different material or help them use that material more effectively as a tool to meeting their needs through the art, which of course, if you have no expertise in making art, I mean, nobody can expect you to be able to do that at home, right? Realistically too, for people living with dementia, unless you're going to sit down and do the music with the person or do the art with the person, they're unlikely to be able to work through the art making in an effective way, because they're going to need a lot of visual cues. They're going to need a lot of support. They're going to need a lot of help to get through the activity, because as we all know, people living with dementia have a hard time initiating activities. They have a hard time ending activities. And throughout the activity, if it's more than one step, they're going to have a hard time organizing themselves to get through the activity as well. So we have an expertise in doing all of that.
Yeah, so music therapy and art therapy at AGI are quite unique in the way that we integrate the creative arts therapies into the recreational in-person programming. So we're lucky that participants kind of get to know one another over hours of time when they come in. And it's unlike other organizations in that way, because often we see individuals and groups that attend tailored programming, or some participants are handpicked to attend the creative arts therapy sessions. So we don't expect participants to come into sessions with a particular skill set in the arts and music. Our philosophy is really, at AGI anyway, is that everybody's creative, and that personal creative expression benefits people. It enhances quality of life. And AGI's participants, like I said, spend multiple hours here getting to know one another. So this really builds a strong sense of community and relationship. And we all work together as a team as well, and our staff, to support one another too. So we're all coming at the work from more informed perspectives. And we also do work with individuals online too.
So we're going to talk a little bit about some of the things that we do in art and music therapy at AGI. But in order to be able to talk about what we do, I always struggle with the question, well, what do you do in art therapy? Because it's not really about what we do. It's always about why we do it. So, we have a lot of art and music therapy students that come through our doors at AGI. We're one of Concordia's training agencies. So they send us lots of students, which is really wonderful, because it allows us to make sure that really the majority of our clients coming through the doors at AGI get either art or music therapy, either individually or in a group. When we have supervision meetings with our students, when I'm with my art therapy students, they know I'm a broken record, because when we discuss what their plan is for their next sessions, they know that I expect them to first tell me what is your goal, and then tell me what art workshop have you created in order to meet that goal. And the goal is either some form of emotional well-being, or it's some sort of psychosocial goal. The word got stuck in my head. Okay, so we set a goal for the client, and then we figure out what we can do in the art to help that person meet the goal. It's a bit of a backwards way of thinking, but it means that really what we do is less important than why we're doing it. Okay, so the therapeutic goals we set could be a goal for the entire group, or it could be goals for individuals within the groups. And really what we strive for is we have both happening at the same time, and we're adjusting whatever art workshop that we bring into the group to both the group goals and the individual goals, so that we may you know, in one group, for example, I might have everybody doing something, an art workshop according to a theme. So for example, today it was St. Patrick's Day because, hey, holidays are great, right? So, you know, 6 different people in the group might be having a slightly tweaked version of that program. So one person might get, you know, a St. Patrick's Day art project that uses markers, and somebody else is going to use paint, and somebody else is going to be presented to them in one way, and somebody else it'll be in another. And the reason why we do that is because we're trying to individualize the same project for individual people to meet their individual goals. Or we might do a program, for example, in my Friday group, I set up 3 tables with 3 different art projects, and I either I have people choose which project speaks to them, or I guide people to specific tables based on what their needs are. So we're looking at the whole group in terms of goals, and we're also looking at the individual participant. Now, the same activity, you know, we might do painting with watercolor with 5 different people or 5 different groups, but I'm using it in a different way, presenting it in a different way to meet different goals. Or I could be meeting the same goal, like I might have the same goal week after week for a group that needs to be working on the same goal, but I might be bringing in different kinds of art projects, all of which I'm using to meet the same goal. So it can go both ways. So we're going to talk a little bit about what some of our most common therapeutic goals are. And we're going to talk more about goals that kind of are overarching goals that we have for the whole group. So some common therapeutic goals, one of the most common ones I would say, and these very often, these overarching common goals are things that are threatened simply because you have dementia. They're sort of universal to the experiencing of having dementia to either a greater or lesser degree, okay? So the first one is what we call agency, and to help you kind of understand what the clinical definition of these are, I tried to give you fun little quotes or pictures that kind of go with each of the goals. So this one is, I'm the master of my fate, I'm the captain of my soul. That's what agency feels like. I am in control of my own destiny, right? Well, when you have dementia, sometimes you lose that sense of control of your own destiny. If you have insight, if you remember that you have the disease, then this thing is happening to you, to the core of your being, and you can't stop it from happening. And even if you don't have insight, the reality is that people will start bossing you around. People will start doing things to you instead of doing things with you, that you'll no longer always get to retain the sense of being an independent participant in your life who's in control. So one of the most frequent therapeutic goals we have, especially for people who are in the early stages of the disease, who may be struggling with the fact that there's been this major change in their life in terms of how much control they have over what happens to them now and in the future. This is a really common goal, and we address it in lots of ways, right? One of the things that we do is try and increase people's sense of being in control, give materials that don't make that person feel out of control. We might also make sure that we're giving people lots of sense of choice, lots of sense of, I can choose to do this or not do this. I can choose to do it in this way or in that way. I can choose to do this activity or that activity. So giving people a sense of control can be really important. Another common therapeutic goal we have is identity. So it's, I am what I am, right? I am who I am. And, you know, most of us who have spent any time with somebody living with dementia know that sometimes we'll hear repetitive stories, stories that kind of become touchstones of the person, for the person telling you, this is who I am. These are my preferences. This is my character. These are my experiences. This is my history. And people start to do that repetitively, one, because they don't remember they've already done it, but two, because having dementia makes it more difficult to retrieve those memories. And who are we but our memories, right? So this sense of who we are the sense of what our identity is threatened by having dementia. And so we can use the creative arts therapies to help people feel better in touch with who they are. So we'll do lots of things like, whoops, sorry, I didn't mean to change the slide. We'll do things like reminiscence therapy, where we'll talk about the past. We'll bring in images from the past or songs from the past, things that will elicit the sense of self, the sense of identity. If somebody tells us a story, if somebody tells me a story over and over and over about their past, I might start to bring in materials and images that actually tap into that story so that they can tell it to me again, or they can tell it to me in a deeper and more meaningful way, by helping them get in touch with those memories, okay? And that can happen in a really active way where we create a workshop that says, okay, this is what our goal is for today. Or it can be something that we're just trying to bring in familiar things on an everyday basis that might help people feel in touch with who they are, okay? All right, so competency. So I found this quote: the trick to having a happy life is being good at something. That's probably a little more extreme than, than I like to think, because I think you can be happy in the acknowledgement that we're not always going to be good at things. But I do think it's important that we feel competent in some way. And as we lose our cognitive skills and our physical skills when we have dementia, we start to lose our sense that we're competent, right? To the point that people will tell us that we're incompetent as a way to get us to accept help, right? But if the person is failing over and over, making mistakes over and over, those are being pointed out, or the person's awareness is being brought to it over and over, it's going to have a fallout in terms of emotional well-being, right? People will become depressed, they'll become anxious, they'll have low self-esteem, they'll have a poor sense of self, and all of those all of that emotional fallout is associated with all kinds of behavioral outcomes that none of us want to deal with. People will start to act in a way that is hard to manage to keep the person safe, right? So our attitude in our art therapy and music therapy sessions is, no matter how much skill is lost, we can help a person feel competent. So our goal is that the person feels like, hey, I can do this, I'm good at this. So we will never bring in art and music programming that makes the person feel like they're a failure. Now, are we perfect at it 100%? No, because we know it's a moving target, ability and skill when you have dementia. Things are constantly changing, and we can see, from one day to the next, a person won't be able to do something that they couldn't do before, and then the next day they can do it. So we're always trying to make adjustments in the moment during the groups to make things easier or harder as needed for the person in order to feel competent. Because of course, if we make everything too easy, that doesn't generate feelings of competency either, because if everything is too easy, you think, well, this is for babies and it's kind of offensive, right? So we're always making adjustments in terms of level of difficulty so that the person feels successful. All right. Is this one me too? I think so, right? All right. So the next therapeutic goal is social acceptance. And this is a really big deal in the group work that we do, but even in the individual work, we want our clients to feel not just that we accept them implicitly, that we enjoy the experience of being with them in the therapy. We also, in the group, want to create an environment where the participants are accepting of one another, where the participants are part of creating this environment of social acceptance. It's part of the magic of that safe space, right? And when we do that, like the quote says, we have the courage to be imperfect. When we feel like we're accepted no matter what, we get to be who we are. So in order to generate that sense, well, one thing that's really important is the therapists and the staff are equal when we're in the room to their participants. There's no, right? Of course, we're the leader, we're the facilitator, we're bringing the what to do, but as much as possible, we're trying to create a sense that you and I we're equals here. We encourage people to encourage one another, right? We recognize the value of attitude as much or even more than achievement, right? So for example, if I have somebody who's never picked up an art material for 70 years, and that person picks up a marker and puts a scribble on the piece of paper, I'm likely to pick up that scribble and put it in a frame and then compliment the person on having the openness and the positive attitude to try something new. Because imagine how difficult it is to try something new when you've been failing at even the things that you've done habitually, even the old things that you already knew how to do. It's an amazing thing to me that people will try something new with us, that they feel safe enough to pick up a marker and put a scribble on a page. And so I need to give them the respect of recognizing the courage and the bravery that happens with doing that small thing. All right.
Yeah.
So next is you, Kayley.
Very well said, that last part. Yeah, so in line with social acceptance, social engagement is a big part of AGI. Like I said, there's a sense of community here when we come together. And I think especially throughout COVID, seeing one another online and having groups and getting to interact was really a critical component of well-being. So when participants come together to engage in the creative arts therapies with others, there is an opportunity for them to feel seen, heard, and respected by others. And this creates a space for acknowledging the uniqueness and creative potential of one another. So really getting to know one another's preferences, histories, strengths. For example, we might listen to a piece of music that's really important to one person in the group, and a discussion might take place afterwards in which that person shares a moment in time in their life that was important to them, and everybody's listening, and maybe that sparks up someone else saying, oh yes, I remember when. So memories can be sparked through musical experiences, and that can allow us to get to know one another on deeper levels. And also by sharing experiences with one another, we're creating a new history. Each session, we're working towards a common goal together. And this allows for a sense of group cohesion and a sense of belonging, as Karen mentioned. So another example, something that we do in music therapy for social engagement is we might write a song together. We'll use a song that already exists and fill in the blanks, and so people can kind of share what their values are as well. So for example, the other week we used the song Imagine by John Lennon, and we had each participant say, imagine there is blank, imagine there is no blank. And so we get a sense of, okay, what would you like to see in the world, or what would you not like to see in the world? And so new ideas are being created with one another, and it helps us to get to know one another on another level.
Ready? All right.
Next, I didn't read the quote there. I just realized. Um, hopefully everybody was able to read what was there. Okay, so in terms of self-soothing and sensory engagement, the arts are really an immediate way for people to access and engage with their senses. Participants at AGI can experience self-soothing or emotional regulation through directly engaging in artistic and musical processes. And this engagement might look like active participation. So it might be singing to a familiar song, or drawing an image. It might also take on the form of receptive engagement, listening attentively to a soothing piece of music, or looking attentively at a beautiful piece of artwork. So appreciating aesthetic qualities of art and music can really draw on a person's senses and draw them into the here and now. And the act of creation can generate a sense of flow. So participants' senses are engaged through sight, sound, touch. And in music therapy, specific experiences can be facilitated that are actually focused on self-soothing and sensory engagement. So just a small example, and this is recommended for all individuals. So what we might do at the beginning of a session is we might take a nice deep breath in, and then we hum out, or we use a vowel sound out. So breathing in and then ah, and we do that for a couple minutes. And what that does is it calms the nervous system down. It calms the fight, flight, freeze response down. And it, if practiced on a daily basis, it's a resource that people can use to help regulate emotions. So self-soothing can be indirect and it can be direct. So that toning experience is a direct kind of coping strategy that we can learn in sessions together. And calm, oh, I didn't read the
Oh,
quote
I'm
again.
sorry.
That's okay.
I apologize.
Calm mind brings inner strength and self-confidence. So that's very important for good health. So there you go, by none other than Dalai Lama. Okay, and verbal and nonverbal expression is huge in creative arts therapies. And I think that's really a unique quality of what we do, is that it is a nonverbal medium and it is a form of communication that we can use. And as the quote says, self-expression must pass into communication for its fulfillment. And so because we're there as witnesses and observers, and there are other group members sometimes, that helps to create that sense of communication. So the arts can be particularly meaningful for individuals living with dementia who've lost their ability to communicate through words. Music and art can carry important messages and act as gateways into people's inner worlds, and in a sense, it appeals to their humanity. This can include communicating values, philosophies, experiences, histories, aesthetic preferences, even just simply saying that something's good or bad is a form of expressing, aesthetic preferences. And music and art can really evoke memories from previous experiences, and give a person the time and space to honor those experiences through expression while feeling supported by other people. In some cases, these experiences can also provide a sense of emotional release or closure. Sometimes crying can be healthy in a session when a particularly meaningful piece of music is being played. And in music therapy, the music is understood as a therapeutic medium. And I don't know if you'd say that in art therapy, Karen.
Mhm.
I'm guessing
Yeah.
you would.
Yeah.
Yeah, it's a language of its own, really. So meaning that
Yeah.
the music is the form of expression, and it doesn't necessitate words.
Yeah. One of the things that often surprises people in art therapy is how quiet it can be. Now, we can have sessions where there's lots of crosstalk and chit chat, and that can be really positive. But there are some times in the art therapy sessions where it can be dead silent in the room, and yet everybody's engaged and everybody is using the art in a way that articulates who they are or what they need to say, right? So that's a little difference between art and music therapy, because music you make lots of noise, and art we sometimes make lots of silence.
Yeah, that's an interesting. Yeah, that is such a difference. Yeah. So through, and just an example, so in music therapy, through recreating a preferred piece of music, we do this a lot in the sundowning program online, which is a drop-in program. So it's we do a lot of recreative music making because it's accessible, and it can be a form of relaxation. But lyrics convey messages that can correspond to people's thoughts and feelings. So a person might request a song because they're feeling a certain way, or because that song makes them feel a certain way. Um, And honestly, singing or simply humming can be used as healthy coping strategies since they're creative rather than destructive to the person. So singing can activate parts of your brain that are linked to emotions. And I remember hearing this quote with dementia, that facts go, feelings stay. And so those feelings can be addressed without the use of words, through music, through art. And that, as we've mentioned, can be really powerful. So we'll move on to the next slide. Mindfulness to the here and now. Be happy in the moment. That's enough. Each moment is all we need, not more. So I won't talk too much about this because I'm sure probably everyone here has heard of mindfulness at this point. And if you haven't, basically it's just being present in the moment, in the here and now. And much like sensory engagement, music and art, it brings a person's awareness into the present moment through engaging with their senses. So the creative art asks for a person to be fully here, immersing themselves in that aesthetic and creative process with the therapist and sometimes other group members. And these new experiences that we're creating can be particularly particularly important. So being in the here and now while engaging in a creative activity can ultimately soothe and engage the whole person, mind, body, spirit, benefiting their emotional and psychosocial well-being. So for example, music and movement can bring a person's awareness to their bodies. Singing requires a person to be conscious of lyrics, melody, rhythm, and that consciousness requires focusing on the task at hand. And finally, for goals, we have relaxation. And this one is big, especially in the sundowning program as well. So I can speak just from a music therapy perspective, that musical qualities can evoke relaxation. So certain elements of the music, slow music, music that's highly structured and repetitive, soft sounding, not too many nuances and changes in the music, can really help to facilitate feelings of relaxation. And even just, I'm sure this is true in art therapy, control over the creative process can facilitate feelings of relaxation. So that sense of control can feel relaxing too.
It's interesting because you can take all of those musical elements and translate them to visual elements, right? Visual elements that are structured, things that you do that are repetitive, images that have repetition in them, not too much, not too little in terms of visual stimulation. All of those are things that can promote relaxation. So same thing, just different medium.
A mirror image. Yeah, exactly. And yeah, just an example also is familiarity can be relaxing and comforting. So just engaging in a familiar piece of music, or maybe looking at a familiar image from nature that brings a person a sense of relaxation, maybe a picture of the woods. Listening Singing also can release endorphins and reduce stress, of course, and it encourages you to control your rate of breathing as well. So that helps you physiologically to relax.
All right, so we talked a lot about some of the therapeutic goals that we have commonly. I think we would be remiss if we didn't talk just a little, very short bit about things that really we consider either not great goals or unrealistic goals for the population of people living with dementia that we work with. One is mastery. We all know that dementia is a disease that slowly robs us of our cognitive and physical skills. And so becoming a master at either music or art, or really any other thing that, there are people who can do things very well, and that's great. And it's not that we discourage people from improving. In fact, it's very, very common that over time, our clients, even if they don't remember having done art or music, will actually improve over time. What's important to know, though, is that that's never the goal. Our goal is not improvement. Our goal is not mastery. Our goal is something else. Sustained attention for long periods of time is another goal that's just not a great goal. Sometimes it happens. Sometimes we'll do art for an hour and a half and everybody will be really engaged in doing it. But most of the time, That's just not realistic. And that's just part and parcel of the cognitive limitations that the person has. We can help people with emotional and psychosocial well-being, but we cannot fix the brain. We can't fix the disease, right? And so number one and number two and number three, these goals, these are all goals related to improving what's happening in the brain, and we just can't do that. There's no good research that engaging in any kind of activity over the long term is going to improve cognition. There is some mild evidence that doing some kinds of cognitive stimulation might improve things in the short term, but if you have a genuine dementia, things are going to get worse over time, and we can't do anything about it. There's also some evidence that doing things like singing or looking at artwork can improve cognition in the moment. But my question about that is always, okay, well, that's great, but why is that our goal, right? Because as an art therapist, I feel really strongly that my client's value is not in their cognitive skills, right? It's in their personhood. It's in who they are, right? It's in that unique thing about them that they bring to the table. And so whether you can do something today or that you couldn't do yesterday, or whether or not your verbal skills have improved during the half hour that I spent with you or not, it's just not really a therapeutic goal for me. My goal is that the person feels well, feels good about their life and who they are, regardless of what level of skill that they have in the moment, right? So even in the very latest stages of the disease, if that person is feeling well, that to me is success, because I can't stop the progression of the disease, but what I can do is help the person feel that they're having a good life, despite the fact that they have the disease. This morning, because it was St. Patrick's Day, we went around the room and we asked each individual participant, do you feel lucky? What do you feel lucky about in your life? And every single participant in the room said, yes, I feel lucky. And every single participant in the room, now this is an unusually verbal group, but every single participant in the room was able to tell us what it is that makes them feel lucky in their life. That's the goal, right? The goal is that they feel good about their quality of life. All right.
Okay, so we've got about 6 minutes left, I see here. So we're just going to briefly touch on some of the activities that we do on a more kind of practical level. So in music therapy, basically, we have receptive versus active musical experiences. Receptive experiences include music listening, responding to music through movement, verbal descriptions, memories, personal associations. We might even use art, visual art, draw, paint while we're listening to music. And we might also look at images of nature while we listen to a piece of music as well. We could also include visualization, like guided imagery, meditation, mindfulness strategies in receptive experiences while we listen to music. We might listen for certain instruments or sounds in a piece of music, or analyze lyrics or discuss lyrics that are important to a person. So that's more the receptive take on music therapy. And then we have more active experiences, and that includes composition, improvisation, and recreative experiences. So composition might look like writing an entire piece of music with lyrics and melody included, or it might be kind of a simpler version of composition where we just, as I mentioned with the Imagine piece of music, we substitute a lyric and fill a blank in and allow that person to kind of convey a message in the music. Improvisation is something that we do, which is basically playing music in the moment. Whatever comes up, comes up. And in improvisation, we might refer to a specific feeling or a specific image of nature. We might say, okay, well, what does sadness sound like? And as a group, we'll try to encompass what that sounds like. And that really encourages group members to listen to one another too. and what their conceptions of sadness might sound like, for example, or happiness, or whatever that emotion is. And then we might also just do free improvisations where there's no reference point. It's just, let's play a piece of music and see what happens, and then we'll discuss afterwards what happened in that unfolding process. And I try my best to support aesthetically through playing the piano or guitar or harmonic instrument. And then finally, this is what we do a lot of, particularly in the Sundowning group, is recreative experiences where we're using preferred music, both familiar and unfamiliar music, group singing, and as mentioned, singing or playing along to familiar and preferred songs can draw on a person's resources, helping to access their strengths, abilities, and personal identities. And certain pieces of music might bring up certain memories, like a wedding song or a concert that someone attended, and we can discuss that further. So recreative experiences are something that we do a lot of. And I do emphasize, even though familiarity can feel nice, it's also really lovely to bring in new pieces of music that we can explore together too.
All right, so like music, there can be looking at art and there can be making art. And we do a lot of both at AGI. In fact, we'll often do both within the same session. Looking at art, we do it for lots of reasons. It allows people to disclose their preferences, which is really important in terms of your sense of identity, right? It can elicit reminiscence. It can elicit a whole variety of emotional responses. And at AGI, we don't feel, as therapists especially, we don't feel like it's our job to make people happy. It's our job to make people feel heard. And so allowing for a whole rainbow of different emotional responses allows us to validate that all of those are heard and recognized and valued. And so, we don't always bring in art that we think each person in the group will like. In fact, very often I'll bring in art that I think that people will dislike so that they can tell me that they don't like it and why, right? Looking at art can also build group cohesion. It can tap into intellectual reserves without there being a right and wrong answer. And while we don't tap into the intellect for reasons of trying to improve it or ameliorate it in some way, for some people, being an intellectual person is a really important element in their sense of self and in their self-esteem. It's a place where they can feel successful. And so looking at art allows people to have that experience without there being a right or wrong answer. It's impossible to make a mistake when you're looking at artwork and sharing your thoughts on it. Looking at art can engage the person who has a need to learn new things. So sometimes we'll do really an art education or an art history element to looking at the art. And it can prime people for art making, because sometimes if we jump right into the art making, if the last time you did art was either with your children or when you were a child, you can sometimes have the reaction that I can't do this, it's for children. And so looking at art that's been created by adult artists can prime people by reminding them that, hey, art is not just something that children do. When it comes to making art, we use a whole variety of mediums at AGI. We draw, we paint, we sculpt, we color, we do sand play, we do sensory stimulation. We'll scrapbook, we'll collage, we'll do things that are productive, we'll do things that we're going to throw away at the end. We do a world of different things, and everything that we do has its place in meeting the variety of needs of the clients. We also do activities that are group activities and individual activities. So sometimes we will, make art that's really personal, and each person has their own artwork. And even if everybody has been given the same instructions, we often marvel about how wildly different each person's approach to those instructions can be, which is really wonderful. We also use the art, for example, everybody will create their own piece and it will go together to create a whole, which allows us to honor the individuality of each person within the whole of the group. And sometimes we'll do artwork where everybody's working on the same project, which really gives everybody a sense of group cohesion, and we're in it together and we're supporting each other, and look what we can create together. So we'll do all of those ways of making art at AGI. So a little bit less the third one because of COVID, because we're not allowed to share art materials, but I'm looking forward to one day, maybe someday we'll get back to that. But we'll do it online, and actually we'll do it quite often online, which is kind of fun. So we also use both in music and in art therapy, we do a fair amount of reminiscence work, which we mentioned before, looking at images, listening to sounds, bringing back people's stories. We'll do it individually. We'll do it in the group with shared experiences. We encourage each person to bring their own history and their own stories in a group context as well. So, and reminiscence, bringing in elements that aren't just talking about it, asking questions about it, can actually really enrich and enhance the person's ability to access those old memories. All right.
Okay, I think we need to wrap up soon because it's 1:02.
It's okay. This is our last slide, basically.
Are we allowed? Are we allowed to go over the slide, Megan? Okay. So I'm just going to touch on the first point here. What does participation look like? We have expectations sometimes that we carry over into our lives, and participation at AGI can take on many forms. I think we've already mentioned that people can be receptive or active, but what's really important is that they're there, they're engaged, and they're at peace. Like Karin said, if they feel good, then that's a sign that what's happening is meant to happen. And not everybody's comfortable with creativity. There can be those past wounds and personal barriers. So we need to take that into account and set reasonable expectations of what's possible. These are not lessons. These are places where people can express themselves. And just lastly, I want to touch on expectations of ourselves too, because as therapists, as caregivers, sometimes there's this feeling that we need to be perfect too. And so I think it can benefit, modeling can benefit people living with dementia in creative processes. So not having to be perfect all the time, and always, it's a personal and professional learning process, everything that we do. So bearing that in mind too.
So, one of the things that can feel a little bit uncomfortable, I know for those family caregivers that have a loved one in the activity center, you're picking them up, they come out of the room, and you're handing an artwork that they created in the day. How do you react to it? What do you do? For a lot of our clients, it's a long time since they tried making art. And a lot of people have had that negative judgment that Kayley mentioned earlier in the past. And so it's really easy to unwittingly derail their efforts. So, I want to give you some tips, ways that you can respond to what the person has done. If you've witnessed it in music therapy, or made, if you're seeing the outcome, the product in art therapy, okay? For one thing, don't get upset if your loved one didn't make anything, okay? There's lots of ways to be engaged in art therapy without making any art, okay? If you're concerned that the person is not engaged, not participating, just ask, because often the person is participating in a much deeper way than you realize, okay? Watching, giving opinions, helping other people, encouraging other people, all of those are ways that we consider successful ways to participate in the art making, okay? When you're looking at the art, okay, and if the person, so it's very likely by the end of the day that the person isn't going to remember that they've created the art. So if I hand you an artwork and you say to the person, did you make this today? And they say no, just let it go, okay? Because the reality is that short-term memory, okay? But if the person is aware, because we do art very often at the very end of the day, not always, but sometimes, okay? So if the person is aware that they've created the art, having a few tips about what you're going to say and how you're going to look at the art can be really helpful. So here's some of my suggestions. try and be specific about what you're noticing, right? Instead of making a judgment. Even "it's really pretty, I like it" is a bit of a judgment because maybe the person isn't feeling the same way about that art. It's not the end of the world because it pops out. You certainly don't want to say "it looks like a child made it" or "you used to make things that are much better than that." But of course, you're smart enough not to do that, right? But instead of making a judgment at all, you can be really specific about what you're seeing. So you can try describing what you're seeing, So, you know what? I see that you used so much blue. Is that the mood you were in today? Or, oh, you chose the same blue that's in our living room. That's so lovely. Or, specifically making observations that describe what you saw and asking the person questions about it, Or it can be something as simple as focusing on the attitude and not on the product. So, I see from what you made that you must have worked really hard on it, Or you tried something new that's so amazing. I'm proud of you. Like, it's a big deal to try something new. I will kind of note sometimes we're not prepared for what we're seeing because of the loss of coordination and the ability to organize things visually. Sometimes our caregivers, I can see, are a little bit shocked by what they see in the art making. So just remember that the benefits of the art therapy are not in the product that's created, okay? It's normal that some things that happen in terms of the person's ability to visually organize the space, okay? So we try really hard to be positive with the person. If you need to take a moment, but we try not to react in a negative way with the person, okay? So I hope that's helpful. I'm going to stop it here because we're over time, so we apologize. I think, Megan, is it question period now, or is it?
Yeah, if you can just stop sharing the screen, Karen, so we can.
Of course.
Everyone, that would be fantastic. Excellent. So I don't have, if anyone has any questions, you can definitely add them into the Q&A or the chat or make a comment. Ladies, I just want to say that I'm a little pleased to have you guys on our team because obviously you know everything, you know how to promote best practices, empower individuals living with dementia, seeing the person before the disease, and treating everyone with respect and dignity. So thank you for that. I do see one question just before. I just wanted to say I'm really pleased that you added that last portion in there, and I'm sure that we could do a whole other lecture about that because I know that families get a little bit embarrassed, or even if the person's voice isn't great and they're online and they're hearing that, or they might sound out of tune because they might be more of a professional singer, have expertise. I know I'm shy when I sing, but as we say in the activity center, you better sing loud and sing proud or else. But I mean, I think that's really important to talk about how families can tend to get embarrassed. You did talk about a really great thing though. You mentioned children and how these activities could potentially be, we could make them intergenerational. And I know that at AGI, we have an intergenerational project that's been on hold because of COVID. But Karen, do you want to talk I'm giving you 1 minute because I want Claire to say what she wants to say. Go ahead.
Sure. So I'm not sure exactly what your question was, but yes, we do have an intergenerational program. I think the art that we create with the children in the art party portion of that program, it's nice because it's the language that our clients can share with the children that come in many ways, right? And I think it's something that is comfortable for the children. It's familiar to the people living with dementia. And it's kind of amazing to see what happens when our clientele and the children that come are working together on a shared group project, because it becomes really, it's an opportunity for our clients to be supporting the children, right? If they were just there talking, it would be, I think the children would often feel that they were in the role of having to take care of the person living with dementia. When we put art in the mix, the opposite often happens, and that's really nice,
Yeah, and we also used to have, but we will hopefully one day have it, Kayley, we used to have a singing group on Sunday afternoons. So that was really an opportunity to have, again, another intergenerational portion as well. I'm gonna, Claire, I'm going to allow you to speak. So Claire, go ahead. Is she there?
Do
Claire?
I do?
Yeah.
We've got some questions in the chat here too.
Yeah, I was just wondering if you could just very quickly give us just sort of a brief outline of the activity session sort of schedule in terms of like when the person goes, is it sort of an hour of this and then an hour of the art and then it finishes with an hour of music, or is it broken generally up in a way, and how long does it actually go?
Yeah, so our activity programs used to be 5 hours, and we could do both art, music therapy, and recreation therapy within the same group. Right now, because we're still working on building up the number of hours that we're in the room together, we're at 3, which is great, but you know, we need a little longer. It's hard for us to fit everything in every single week. So some groups will get music therapy right now, some groups will get art therapy. And yeah, we schedule it within the schedule of the day. So we'll be scheduled to come in for an hour during a 3-hour group. Yeah.
Okay, so just if you could just keep us posted as to when you go back to the 5 hours, just because to find, you know, to drive all the way over there just for 3 hours and all the way home is hardly worth it.
We all have the same goal. We all want to get up to 5 hours as fast as we can, but because we're working on a hybrid model, we have to manage staff time as well, right? So that's all Megan. Ask Megan.
All right, I'm going to mute you again, Claire. So I also see, let me just see. I also see that there's a message in the chat. First of all, people are really appreciative of having this opportunity to better understand the creative arts. But it says that my mom was working on some scratch art and having fun. She went to the bathroom, she came back, asked who was doing that. She told her she had been, and she, you know, and she'd been working on it and she continued to do it or do a puzzle. So what would the best approach to be? They didn't want to force her.
This is such a common thing to happen. This is like, because as soon as, I mean, we can even have a situation where a person looks away, gets distracted, looks back and says, who did this thing that's in front of me, right? It's a simple short-term memory issue. I think that you handled it really well. Right? I think that the response is also going to depend on the individual person. Some people might get upset when you tell them that they were working on it. Some people will say, wow, that's great. I'm doing a good job. Right? So, you know, gently letting the person know that they were working on it is fine. Giving the person the choice to continue or go back. You also don't have to say when she was working on it. Right? So yeah, I think that your response was fine. You know, if you told me that you told her she was working on it and she freaked out and got anxious or upset with you, then I would say, well, let's not do that again, right? But based on her response and the fact that you gave her a choice, I think that's great. I think that's a perfectly reasonable way to respond.
And responses change, right? She could respond one way one day and another. So we just learn from that person's mood and go with the flow.
Yeah, what we never want to do is force the person to claim something that they created as their own if they don't feel it themselves, right?
Yeah.
The example I always give in courses is, if I told you I saw you dancing on a bar on St. Catherine's Street last night, it doesn't matter how much I want you to believe that I saw you doing it. If you don't remember doing it, it didn't happen, right? So
it's fitting on St. Patrick's Day, Karen.
I know, right?
Oh my gosh. Okay. So I just want to thank you. I think that for anyone who has more questions, please call AGI, speak with a counselor. We'll link you up with music therapy or art therapy, and stay tuned for schedules, things in the newsletter, and you can find out more about upcoming programs. Thank you, ladies. I wish you a wonderful day, and we will see all of you very soon. Take care.
Thank you. Thank you very much.